because I don't want to delay the rest of you. So I'm just going to kick us off in a moment. Lemuria has started the stream. Give us a sec.
Okay, you can still go.
Great. Thank you, Lemuria. Good afternoon to folks out in the planetary universe who are fascinated by the Health Occupations Subcommittee of the Education, Health, and Environmental Affairs Committee of the Maryland State Senate. I'm Cheryl Kagan, very proud to be the Senator for Gaithersburg and Rockville and the chair of this subcommittee. With me today are Senator Ellis, Senator Gallion, Senator Lamb, hopefully joined momentarily by Senator Hester, our excellent new legal counsel, Alexis Foxworth, some interested parties, and coordinated by Lemuria Stanton, who is the assistant to the chair. The goal of today's meeting is to explore, navigate, and debate and discuss, and then vote on 3 bills that were seen as a little too complex to discuss as a full committee. And so we have a group of us working on these today. And we are going to start with Senate Bill 34. Senator Lamb is the sponsor. And I am also going to turn this over to Ms. Foxworth, and we'll go from there. Senator Lamb, do you want to start by refreshing everyone's memory as to what this bill does? And then we've got amendments before us, and we can also discuss any other issues that come up. And I want to welcome the advocates who are with us from Johns Hopkins, the Board of Physicians, and the chair of the oncology, LUMA, and then it cuts off.
Luminous Health.
Luminous Health. Okay. Thank you, Dr. Riker. Okay. With that, Ms. Foxworth, or Senator Lamb first.
Sure. So happy to do a quick refresh on what this bill is or does. So Senate Bill 34 sets up a licensing structure for genetic counselors. Just as a reminder, genetic counselors are already practicing, but there's no licensing ability for them. So the concern in part is that you could have anyone just hang up a shingle that says genetic counselor and they would be able to, practice in a way. This would make sure that they are licensed, that for individuals that are using the term genetic counselor, there is some protection for these patients that are going to see a genetic counselor. And obviously these are some really important decisions that these genetic counselors are counseling these patients on. And so, just want to be clear about that. This bill did pass out of committee and also out of the Senate last year. It did fall short just because of the abbreviated session. There were some main points that were outstanding that we've tried to work with the board, and we've had a series of meetings with Matt and others to try to address some of these. So one, for example, is the advisory committee structure. And there will be an advisory committee to inform the Board of Physicians on how to, promulgate regs on this. There's a sponsor amendment that will allow there to be 4 genetic counselors, 2 physicians, and 1 consumer member. This is actually to address, I think, the fact that there was an even number in the advisory committee, so we needed to make that an odd number, and also to make sure that genetic counselors have the ability to weigh in individually and not be kind of outvoted on some of these issues. There's an issue with out-of-state exemptions because genetic counselors often rely on condition-specific experts, and those experts may actually reside in another state, particularly for these really rare genetic conditions. So there is a sponsor amendment that exempts out-of-state genetic counselors with conditions attached. Some of those conditions are like it's limited to consultation, or they have to be it has to be under the care directly provided by a licensed physician here in Maryland, et cetera. That's in the sponsor amendment packet too. There's a larger issue that pertains to recent graduates. So recent graduates, I think the concern was they're not offered the licensing tests quite as frequently. And so there's concern that if somebody graduates from a program here in Maryland and they're not able to have a temporary license or some type of a exemption to be able to start practice, that these genetic counselor graduates might leave and go to a different state to practice because they don't have some provisional ability to practice. And so there are other, professions that are covered within the board that do allow for, I think, some type of a rolling process to get them in. And then there's two more outstanding issues, one for a grandfathering clause. So there's, a provision in there that if they've been practicing for more than 5 years under an accredited master's degree and have the proper professional recommendations, that they would be grandfathered in. There's also a referral requirement that's a little bit more detailed, but this helps ensure that individuals that don't already have a primary care provider would not be harmed with the referrals that could take place here. And then there was an ask to delay the implementation that the board, I think, prefers that many of the genetic counselors we have some reservations with. So there's an outstanding issue there. That's pretty much the bill, just to recap it quickly for folks. I don't know if Alexis, you have anything else to add from the council's perspective?
Thank you, Senator Lamb.
Sure.
Ms. Foxworth, so we do have two amendments, as Senator Lamb indicated. I hope committee members have those in front of us. Alexis, do you want to pick up on what Senator Lamb talked about and either add anything about the bill or about amendment number 1 or number 2?
Sure. It seems like Senator Lamb did a pretty great job at explaining everything that's in here. So I can just add, in general, as mentioned, this is requiring the licensure of genetic counselors by a particular date. So it'll be by October 1st, 2023. It doesn't affect those that are practicing at the current moment. It doesn't inhibit their ability to practice, but prospectively by 2023, this would need to be in place.
But right now, sorry to interrupt, October 1, 2021 is the bill as it came in. The proposed amendment was to make it 2023, correct?
Well, as it states now, so it'll go in effect on 2021, but the licensure, everyone that practices will have to be licensed by that particular date.
Thank you. Okay.
Right. So there's a bill effective date, and then there's the actual implementation of the regs and all that whole structured process.
Yep. Perfect. Thank you. Okay.
Yep.
So we have some interest groups here. What makes sense in terms of, so we do not want to take 2 hours on this conversation. Is there anything there? We have 3 advocates here. Dr. Riker, I'm sorry, is it Dr. Applegate or Ms. Applegate?
Ms. Applegate, it's fine.
Ms. Applegate, okay, Mr. Dudzik, and then John Richardson. If you're willing, in the upper right, if you're willing to rename and put your affiliation, it'll help us keep straight who's what. So welcome. We are on Senate Bill 34. If you want to rename yourself and tell us your affiliation.
Yeah, I'm John Richardson. I'm with the National Society of Genetic Counselors.
Great. Your timing is good. Okay. So does anyone have anything that Senator Lamb said that they disagree with or really, really need to amplify or clarify? Okay. All right. So.
I'm sorry. This is Matthew Dudzik with the Maryland Board of Physicians. We do have some responses. I'm not sure if this is the appropriate time for that or.
On Senate Bill 34?
Yes.
Yeah, I think that makes sense.
Again, Matthew Dudzik with the Maryland Board of Physicians. And I do want to apologize because the timing of this subcommittee hearing was a little bit accelerated beyond when we thought it would occur. So we actually don't have some proposed amendments together at this point. We have been in discussion with Senator Lamb's office. I want to thank Senator Lamb and his staff for being willing to work with us both over the interim and recently. We certainly are willing to adjust our position in ways that can make this work for both parties. specifically regarding a couple of things that the senator brought up regarding the makeup of the Genetic Counselor Advisory Committee. I know that there were concerns that with the structure that we proposed. So right now we have 11 allied health practitioners that are licensed and regulated under the board. In all cases, whenever they have an advisory committee or a similar body, the makeup of that committee is typically an even number of the allied health practitioner in question and physicians that are that have a familiarity with that profession. And then there is a consumer member that will break the tie. That is the structure that has always worked for the other allied health practitioners. And certainly I understand the senator's concerns that with a structure like that, it's possible that something could move forward or move out of committee without any input from genetic counselors. Of course, we would have the similar concerns of something moving forward, that the physician community would be opposed to. While anything that moves out of committee still has to go before the full board of physicians, when we're talking about things like the promulgation of regulations, it is a problem for the committee and the board to essentially play a ping pong back and forth with something as time consuming as regulations. We have always felt that in the very rare instances where there is a major difference of opinion between the physician community and the allied health practitioner community, that it makes sense to have the consumers of Maryland be the tie-breaking vote. In terms of the advisory committee makeup, we would still very much insist on an even representation between genetic counselors and physicians with a familiarity with genetic counselors. Regarding the implementation date, we have been having internal discussions. Certainly we are willing to move that implementation date a little bit forward. There are still significant concerns with the date as proposed in the bill. And I've been having, and again, I apologize that I don't have a counter amendment at this time. It still needs to be brought before the board for the board to approve. But there are, right now we regulate 45,000 physicians and allied health practitioners. We have been struggling to maintain all essential operations and keep our staff safe during the pandemic. Is exceptionally difficult for us to add a new health profession at this time. We are not asking for an eternal delay.
So, Mr. Dudzik, could I interrupt you? If you say there are going to be amendments and that you've been working with Senator Lamb,
yes.
Let me just push the pause button and ask a question. How soon can you have amendments to us? And Senator Lamb, would it work for you if we move to the next bill, wait for a very brief period of time? I don't mean hours, but like still pretty quick turnaround, so that you and then the rest of us can consider the Board of Physicians amendments. I don't want to.
Yeah, I'm open to the pleasure of the subcommittee. I don't know if, I think Matt was putting them into was requesting, I think so, right? This sounds like you requested the amendments, or is that just a proposal?
So yes, so we submitted with our position paper, we submitted proposed amendments. Of course, we've had discussions since then. We are, there are some things like our referral requirements. We are willing to accept the existing language with the referral for diagnosis or treatment, things of that nature. And we are working on a solution for the recent graduates issue, things of that nature as well. Certainly we could have this ready within a matter of days at the most. I'm not sure, I don't think I could have something ready in hours.
Sure. No, that's what I said, not
Right.
hours. I'm not trying to be unreasonable here. So let me just note, Mr. Dudzik, that Senator Lamb requested this bill on July 9th. And so presumably he's been talking to people about this for a long time. So I think our committee is interested in putting out solid legislation on the floor and hearing from interest groups and experts. At the same time, we have a limited period of time. So Senator Lamb, are you willing to push a pause button on this bill and, you know, have us reconvene just on this bill next week, early next week?
Yeah, I think, yes. I think we do need to expedite these amendments and then hopefully get them to the subcommittee with enough time to kind of review them so we can convene early next week and just move forward with this.
I agree.
I know Dr. Riker had his hand up. I don't know if there was anything meaningful you wanted to add.
Yeah, I do.
But-
I'd like to respond to some of Matthew's comments. Just give me a couple of minutes. We've gone through this now. This is year 2. Here we are again. And the first year, I would point out that the board was absolutely opposed to this. So a year goes by, and all of a sudden, they then submit 6 amendments. And now we're here again with these 6 amendments. Now they want to make more amendments. I've never had to deal with a board that has put so much effort into trying to oppose something as to trying to support something that needs to be accomplished.
So thank you, Dr. Riker. I think we try really hard to discern the difference between delaying tactics and thoughtful either engagement or disagreement or whatever. So we'll call in Senator Gallion in a second. So my suggestion, Mr. Dudzik, if it's the subcommittee's pleasure and with due deference to Senator Lamb, we would like to see anything you've got by Thursday, close of business. They would go to Ms. Foxworth, who could look at them on Friday, share them with the committee, and then this subcommittee would reconvene the very first part of next week. So we're not slowing this down at all. So that's the concept that I'm putting out there. I'm not speaking for the subcommittee. Senator Gallion, what would you think about that?
Thank you, Madam Chair. And I kind of defer to Senator Lamb on this too, but this doesn't seem terribly different from what we passed 46-0 last year, right? So, I mean, how long are we going to beat this thing around? Let's figure out, get on with it. I appreciate you, Madam Chair, for kind of setting a deadline. I say, let's just get this stuff in, figure out what we're going to do and keep rolling. We've got a lot of things ahead of us. So I'd kind of just like to, I appreciate that deadline, and then let's move forward.
Okay. Senator Lamb, does that work for you, what I laid out?
Yeah, that works. We're happy to try to get those amendments expedited to everyone the rest of this week, and then we can go from there.
Okay. Matthew, 5 o'clock on Thursday?
Absolutely.
Okay, we're moving forward without you if we don't get them by then.
I
Okay,
think
Fair?
can I make one comment?
Yes.
These are
briefly.
still amendments. Are we saying that we're going to discuss the amendments? Are we
Oh,
going
of
to?
course. Of course. This is just adding to our menu of options, and you all will be able to weigh in. We will have them. Ms. Foxworth will
Fair enough.
to evaluate them and make recommendations, and obviously Senator Lamb and the rest of us as well. So, okay, so with that, Senate Bill 34 is put back on hold. R. Scott, I asked before you came in, number 1, could you introduce yourself? And number 2, welcome. And number 3, in the top right corner of your window, if you're willing to put your full name and your affiliation so we know who's in the room and those watching know who's in the room, that would be great.
Madam Chair, members of the committee, my name is Rhonda Scott. Can you hear me?
It's really,
It's really, I don't know if it's my connection. Let me see.
why don't we start by having you rename yourself in the top right corner, and then
Okay.
by the time you're ready to speak on one of our bills, since we are now done with Senate Bill 34, maybe by then you
Sure.
can figure out the audio. Ooh, I think you just got better. Whatever you just said, the sure sounded good.
Okay, I'm still trying to find where I need to rename myself, but
Top right corner of your box. Okay, but we're gonna move on now. So we're
Okay.
gonna move to Senate
Thank
Bill
you.
84. Can
We're
you say,
still in our subcommittee meeting.
Senator Hester, could you mute yourself, please? Ms. Scott, if you could just continue and just say your affiliation, please.
yes, my name is Rhonda Scott. I'm the Deputy Director with the Maryland Board of Nursing.
Perfect. Thank you. We're glad you're here. Okay.
Thank you.
Senator Young or Senator Wallstreicher are not here with Senate Bill 84. So Ms. Foxworth, if you can kick us off on that, that'd be great.
All right, so Senate Bill 84 deals with pharmacists and administration of self-administered medications and maintenance injectable medications. It would require the Maryland Medical Assistance Program and the Maryland Children's Health Program, which both provide insurance to low-income individuals, to provide coverage for these maintenance injectable medications, and to mandate that insurance providers all throughout the state that are covered under our insurance article to also provide coverage for pharmacists to administer these maintenance injectable medications, and expands the practice of pharmacy to administering maintenance injectable meds. Permits a pharmacist to administer a maintenance injectable medication that is not a biological product under certain circumstances, and with written approval from the health prescriber is also required. It requires the Board of Pharmacy, in consultation with the Board of Physicians and the Board of Nursing, to adopt certain regulations and procedures, establishing those procedures that will provide some sort of guidelines for the pharmacist to administer these medications and procedures used in post-assessment after an initial dose is administered. Requires the regulations that the board adopts to require pharmacists to undergo certain trainings. It requires the Board of Physicians the Board of Pharmacists to adopt these regulations pertaining to what a pharmacist has to do after these assessments or after the medication is administered. So again, I think I mentioned that the insurance article is also covered under this, a mandate for insurance providers. There are 3 amendments, 2 of those are sponsor amendments, and one of those is sponsored by Senator Lamb.
Okay. Could you start with describing each of the amendments, and does everyone on the committee have access to those amendments?
Yes.
Okay. So if you wouldn't mind describing them and how they would modify the bill.
Okay, so the first 2 that are sponsored by the sponsor are technical amendments. So we changed the word of administering or administration to administering. And these are technical so that it matches with the House cross file, so it doesn't really change the substance of the bill.
Yep.
Senator Lamb's amendments would allow these maintenance injectable medications to include medications that specifically treat sexually transmitted diseases within the broad umbrella of what a pharmacist can administer and what these maintenance injectable medications can be administered for.
So I have 3 amendments on Senate Bill 84 and none of them, no, I'm not. I have 2. I do not have the Lamb amendment.
Okay, let's see if I can forward that to you. So the Lamb amendment was submitted on Monday by Scott. I can forward that to you. That was not in my most recent
If you would, that'd be great.
email, sure.
And let's see, does everyone else on the committee have the Lamb amendment? Should we send it to everybody here?
So everyone should have all 3. The former 2 that were by the sponsor were sent today, and those from Scott were sent yesterday. But I can go ahead and do a quick forward.
If you wouldn't mind, I guess I have so many windows open that.
Sure.
Yes.
And if you want me to speak about the STI amendment, I'm happy to, but I don't want to take up the time if you are comfortable with it, so I'll defer to you.
No, Senator Lamb, while we're waiting to get that email, absolutely. Sexually transmitted infections.
Right.
STIs, yes.
So this was an issue that was brought forward to me by some providers at Hopkins that treat patients that have STIs. And that's why I asked about it during the hearing itself. The amendment is to clarify that pharmacists can inject antibiotics for STIs. That currently the language that's in the bill would already allow them, in many ways to inject for HIV, but it's not clear based on the language there whether that would include other STIs also, other sexually transmitted diseases. So things like syphilis and gonorrhea, of which there's been an uptick recently. And also now, given COVID, it's harder for them to get into seeing a doctor to actually, get them an antibiotic shot. So, this would expand that to just include those STIs where it can be treated with a simple antibiotic injection. And that way, it helps reduce the access issue for these people that, potentially have a condition that could be fairly easily treated. It's actually not that much different than doing a COVID vaccine injection. And so, they would just be able to also administer these antibiotics, and these antibiotics are fairly safe. They're actually pretty safe. And so it's probably safer than some of the other things the pharmacist may be able to administer as part of this bill itself. So it's really just to cover some of these STIs, and also in a way would help reduce antibiotic resistance. We want to get these folks treated as quickly as possible, and to get the full regimen, making it as easy as possible to get the full regimen of the antibiotic that they need would help reduce antibiotic resistance too. So that's kind of it in a synopsis. I'm happy to dive more into the details if anyone wants to know more about it.
Okay, great. So everybody should have a copy of the Lamb Amendment to Senate Bill 34. It says treats a sexually transmitted infection and is not a vaccine. So it appears to this senator, and maybe it doesn't to everybody, but it appears to this senator that the two Young amendments, as Ms. Foxworth said, are technical in nature. And the Lamb amendment for sexually transmitted infections seems like a good common sense addition to the bill. I wonder if anyone else has any disagreement with that, or whether we might move forward with these three amendments to the bill.
Just to be clear, so it's just for antibiotics, right? Is that what you're talking about?
It's for the treatment of STIs.
Antibiotics?
And that's basically antibiotics, because all of these are that's the only thing that you can actually treat by injection.
Okay.
For STIs, or basically antibiotics. You're not going to inject anything else into someone that has an STI.
Okay.
Thank you.
And there's nothing about this that is in any way related to pregnancy or?
No.
Okay, nothing.
And we did communicate with the
termination.
sponsor, and the sponsor is okay with this too.
Okay, just checking on that. Senator Ellis, Senator Hester, any questions or concerns about these three amendments? Is there a motion on the three amendments then? I hear no motion.
Move favorable.
Move favorable. Senator Gallion, second by Senator Lamb. Does anybody wish to be on record opposing the three amendments? Seeing none. Then the motion, could I have a motion on Senate Bill 84 as amended three times? Motion, Senator Ellis, second by Senator Lamb. Anyone oppose this bill as amended three times? Seeing none, Senate Bill 84 will be recommended to the full committee as amended. Thank you, colleagues. And now we are on Senate Bill 183. And I will tell you that this was a very good sleep aid last night at midnight as I was reviewing it again. This is a long bill, but an important bill, as they all are. Alexis, do you want to, Ms. Foxworth, would you like to review Senate Bill 183 for those who are hearing about it for the first time?
Sure. So Senate Bill 183.
Whoop, you just remuted for some reason.
That's funny.
There
Sorry.
you go. You're good.
So again, SB 183, Audiology and Speech Language Pathology Interstate Compact. Essentially, this bill facilitates the creation of an interstate compact for audiologists and speech language pathologists. Under this, member states so defines terms, member state, remote states, determines who can take adverse actions, which laws apply in certain situations. Member states are required that an applicant obtain their licensure in their home state and abide by their rules for licensure renewal. It establishes those requirements, educational, clinical, et cetera, for audiologist members and speech language pathologist members who want to enter the compact. It states that the privilege to practice is derived from the home state license, establishes the requirements in general that have to be met to enter the compact, and it establishes a commission, the Audiology and Speech Language Pathology Compact Commission, that will oversee the facilitation of all of the regulations, entry and discipline, membership, leadership, et cetera, of this interstate compact. One amendment, which is a sponsor amendment. Actually, let me confirm that this is a sponsor amendment before I miss.
The one on page 12, changing may to shall.
Yes, yes. So what the two amendments?
Yes, it is a sponsor amendment. It's down as Senator Young.
Okay,
Mhm.
okay, thank you.
Mhm.
So the amendments will require those clinical experience requirements that are listed under educational qualifications to be governed by the commission, this Audiology and Speech Language Pathology Compact Commission, and not the licensing board. So it strips that authority. It requires the home state to, so the home state can only be changed based off of application. So it alters that procedure for changing the home state. Let me see, one more thing, sorry. It permits the member state to recover the cost of investigations, where prior it was the home state will recover the cost of investigations and disciplinary procedures. And finally, it removes the home state's mandate to take adverse action in certain scenarios based on the findings of the home state, as it was under the proposed bill. So the amendment would permit the member state to take adverse actions based on findings of the remote state. So we're talking about which laws apply in certain scenarios. That's what those amendments are addressing.
So I had a number of questions on this. Colleagues, if you wouldn't mind indulging me, unless anyone else has questions first. Okay, then I'm gonna head out. Okay, page 3, and Ms. Foxworth, I'm not sure how many of these you'll know the answers to right away, or how many we may have to check with Senator Young or any of the advocates. So this is all about access to speech language pathology and audiology. That's why we're doing this. And on page 3, it's talking about sort of the whole reason we're setting these up across state lines is there's no one near me, but you know, if they can practice someone from Pennsylvania or Virginia or DC or whatever. Is that a problem? Do we know that it's a problem? And Senator Lamb, maybe you have answers to some of these. Okay, so that's my first question. Some of these might be smaller questions than that, but that just seemed a basic, like, do we have a problem that this bill fixes?
I mean, I'm not sure specifically about the speech and language pathologists. Usually there's some interstate compacts that allow neighboring states to be able to have folks that are licensed in one to be able to at least have some reciprocity across state lines to the neighboring state.
Yes.
I'm just not familiar with specifically about this.
Okay. Second, on page 6, lines 16 through 20, Senator Lamb, the telehealth, it says that it's for assessment, intervention, or consultation. Just want to see there's no treatments or anything else that can be done through telehealth for audiology or speech language. It seems like through video, they might be able to actually provide treatment. And I just want to make sure we're not limiting that.
I think, and I'm not the board, I think they get queasy about treatment. I think, you know, these speech and language pathologists probably still need to work in consultation with the physician. I think that's why in a lot of these ancillary providers, allied health providers are not using the word treatment and are really, you know, deferring that to the physician, but work in consultation with or counsel the patient in, et cetera. But the actual, you know, diagnosis and the treatment comes from, you know, their provider, which could be a physician, could be an NP, could be a PA, I think.
Okay. Page 10, lines 24 and 25. The adverse actions. Have not had any adverse actions against any license or complex privileges within the past 2 years from the date of application. 2 years strikes me as a little short. Just wondering if that's customary for other compacts. And again, this may need to be something that we learn. So
Yeah, I'm not sure about that offhand.
Okay,
I can definitely do a research project of that, Senator Kagan.
that would be great. I'm gonna skip that one. Let's see, page. Skip that one too. Just a couple more. On page 19 at the bottom, lines 29 to 32, the commission is going to keep the minutes. The meetings are going to be public, except when they need to be private for confidentiality and all that. But it doesn't indicate that they are going to be posted anywhere. And how does keeping minutes make any sense unless they are shared and accessible? Just again, wondering, is this typical language, and do we need to be modifying that would be on the Compact's website or the home state website or something like that?
I'm sorry. So on the minutes and similar compacts, I can put that in and do a little bit of research, but I'm not sure offhand the assessment on the states that have it and how they handle meeting minutes and meetings in general.
You know, if it's supposed to be available to the public, like how is it going to be available to the public? I'm just curious. It seems like what we're doing with other boards and commission is asking that they post the meeting minutes on their websites, but it doesn't specifically say that.
Okay.
And I'll skip that question too. And then the last question was the effective date of this October. I guess nobody objected to that as being an unrealistic start date.
I didn't get any amendment request about changing it or delaying it.
Okay. All right. So then let's assume that that's okay. So I don't think any of these are huge, but I think some of them are worth checking out. So this is not out of opposition to the bill, but just wanting, again, to make sure that we're sending our, kind of the best possible work. So colleagues, if Ms. Foxworth could get us answers, are you okay with just holding out for those answers and running through this bill pretty quickly when we reconvene for Senate Bill 34?
Yeah.
Okay. Okay. So I think 34, there's a little bit more of an ideological or priority issue. I think this is more just devil's in the detail, just making sure it's solid. So,
Also, Madam Chair, on this bill, there was a lot of unfavorable testimony in the folder on this one. Talking about possible amendments, can we just find out maybe before next time if any of those amendments would cause, say, for instance, MedChi to withdraw their opposition? If we're looking at.
So the audiology, the Department of Health was unfavorable, and the Maryland Society of Otolaryngologists were unfavorable. Oh, so we're MedChi. You're totally right. Yeah. So Ms. Foxworth, since none of the three of them are present with us now, maybe we can make sure that, if you wouldn't mind, can you circle back with them and see if they've got anything, or if there are specific issue areas, or you can invite them to whenever it is we connect again.
Sure.
Okay.
That would be
Thank you for
terrific.
flagging that, Senator Gallion, because I had
Thank
noticed
you.
that on another bill, but not on this one. Thank you. Okay. Well, we move one of the three. So yes, Senator Hester.
Thank you, Madam Vice Chair. I was just trying to figure out, imagine if this is an interstate compact, language has been adopted by the other states in the compact. Is that correct?
Yes, that would be the expectation. And that's
So
why
if
some of my questions were about, is this the way it's being done elsewhere?
Right. So are we allowed to change it then and still enter the compact? That's my question.
That's a good question. I would think that home state treatment versus other state treatment might be. Ms. Foxworth, do you have any data on that by any chance?
Are we allowed to change any of the provisions?
So in other words, we can't change how Virginia does it, but we can change how we do it, right? Is that basically what you're asking, Senator Hester?
I guess so. I wasn't sure if there was any kind of like joint action across the state. So like if we say that all the meetings have to be, Open Meetings Act, and we're meeting with Virginia and Virginia says they can't be open meetings, is there a conflict? And I'm not an expert in this area. It just occurred to me that if we're changing language that other states have adopted, it might be a little more complicated.
It's a great question.
That's a good question. Let me think on that a little bit more.
I think we're going to keep Ms. Foxworth a little bit busy until in the next few days.
Fair enough. That's completely fine.
Any other questions that anyone has on either of these two bills that are still pending that Ms. Foxworth could put a little research into or check with others on? Okay. Seeing none, Ms. Foxworth, are you clear with what the questions were? And if not, you can follow up with me or with any of us. And this subcommittee could adjourn if we're otherwise complete. Okay. All right. Well, thank you. We got one off our plate, and hopefully my expectation is that we will conclude early next week with the other two that are pending. Okay. Thank you very much, colleagues. This subcommittee meeting is adjourned.